We are ready, sir.
Okay, thank you, Abhishek. नमस्कार, मेरा नाम डॉक्टर आलोक रॉय है एंड हर हफ्ते हर सैटरडे को हम आपके लिए लेके आते हैं स्वास्थ्य से जुड़ी various incidences, what can be done for you to stay healthy. Every Saturday we bring it because we believe it that health is the ultimate wealth, and small things can keep you happy and healthy. You really don't need to go to a doctor if you just follow some of the very fundamental process at home. When we started this series this year, we started with Omicron, and first 2 episodes were dedicated to Omicron, and we knew that it's going to get petered out. So last week we started on the how to take care of your health, especially the health for the lungs. We call it winter and lungs. That how can you save yourself from various diseases of the winter. Winter is still on, we are still shivering. And the one of the worst problems of winter is brain stroke. But it's fully preventable. It can be addressed very easily. And unlike in the past, जिसको हम लोग कहते हैं लकवा या पैरालिसिस, पहले क्या था कि if you get brain stroke, it's kind of you are paralyzed for life. All those have changed. The new treatments, the new preventions, new aggressive management has brought the life back all those who had a brain stroke. Today, I have none other than Dr. Harsh Jain, who is one of the topmost neurosurgeon of Eastern India. He is not only a surgeon, he is a very nice human being. And he looks after his patients with all the commitment he has. We are very fortunate to have him with us to talk about in our weekly webinar every Saturday, 5:30 to 6:30 on today, he'll talk about brain stroke. But before I go to him, we are joined this week onwards with the Bengal Chamber of Commerce and Industries, who have become our partners, and they are bringing their people in, and also Rotary Club of Avanya. We are extremely grateful to both of them, Rotary Club and Bengal Chamber of Commerce, for bringing more people into it. Our intent is, Medica wants that you should all stay healthy, and they bring different set of people whom this message reaches to, and they all can be healthier. With this, I hand it over to Dr. Harsh Jain. Harsh, over to you.
Thank you very much, Dr. Roy, for that introduction, and really commend you for taking this initiative of bringing important health issues to the common public. And can I have my slides, Abhishek? Okay, full screen, yeah, okay. So, good evening, everyone. And as Dr. Roy mentioned, I'm going to try to speak to you regarding a very important condition, disease, condition, whatever you call it, that affects a very large proportion of population worldwide and increasingly so in India. And stroke or a brain attack, next slide, please. Stroke, which is also a brain attack. You see, a lot of us, we are all very familiar with a heart attack, right? And you'd be very surprised how many people associate, cannot always make the distinction between a stroke. What is a stroke? Is it affecting the heart or the brain? And I'm sorry if I'm being very simplistic here, but I will try to make it absolutely as simple and break it down as easy as possible for you to understand. Of course, there have been many knowledgeable people in the crowd, many who have friends and family who have suffered stroke and have actually been to the hospital. So are more knowledgeable about this, but let's see where this all takes us. So briefly in the next 15-20 minutes, I'll take you through what is exactly a stroke, what are we talking about, which is the organs involved, and what is it due to, what are the mechanisms, what are the types of stroke. I will briefly touch upon what is the extent of the problem and Usually when we have talks and things, a lot of the data that is available is from the US, from the UK. I will try to show you certain data published by the government of India, which highlights the extent of the problem. I will talk about the symptoms and their prompt recognition. And this is the key here, that stroke is a sudden event. It has a certain very characteristic pattern of symptoms which can be picked up by an onlooker, and then what one should do about it. I will very briefly talk about certain conditions which are stroke mimics. So that means not everything which looks or sounds like a stroke is necessarily a stroke. So I will briefly mention those, and some of these conditions will be familiar to people. I will again briefly touch upon the treatment of stroke, but most importantly, the whole purpose of this series, this seminar, this initiative from Dr. Roy from Medica is to talk about those conditions which have identifiable and modifiable risk factors, and hence prevention. So next slide, what is a stroke? So by the book definition, it is a rapidly developing symptoms and signs of focal loss of brain function. Now, each word is important here. Rapidly means it has to be sudden event. It is not something that builds up over a period of time. It has to be a sudden event. And it is focal. That means it affects one part of the brain. It doesn't affect the brain as a whole. So one part of the brain, and you will see why that is important. And the cause is arising from a blood vessel problem. So these three things have to be fulfilled for it to be called a stroke or a brain attack. Now, essentially what it is there is a sudden interruption of blood supply to any part of the brain. Now, as we know that any organ, be it the heart, be it the lungs, be it the kidneys, the eyes, they have to have blood vessels which carry nutrients, oxygen to that organ. And there are veins which take away these deoxygenated blood away from the organ, right? So if there is a sudden interruption of nutrients and oxygen going to that part of the brain, it is not going to function. And that is exactly what a brain stroke is. Briefly, I will tell you, and this is very important, that there are mainly three types of stroke. One is what is called an ischemic, but basically it means that there is a reduced or sudden blocked blood supply. And it is this variety which actually is the commonest variety, which is what we most commonly talk about, deal with, or experience. And in fact, as high as 87% of all so called brain attacks are of this variety. The other two are the hemorrhagic, where essentially it means that there is bleeding inside the brain. The third, which is TIA, which is not actually a variety of stroke, but is probably more important than these two, which is called a transient ischemic attack. It is essentially a warning sign. So what happens here is that the patient gets the symptoms of a stroke. That means one part of the body, hand or leg, can become numb, vision can be affected, speech can be affected, but these symptoms go away within a span of anywhere between 5 minutes to 24 hours. So what this means is that if this is appropriately and promptly recognized that this person has had this transient event, then that person should ideally be very promptly seen by a doctor in a specialized center, and all the possible investigations, diagnosis, workup for a possible stroke should be done, with a view that all types of treatments, medication are started quickly to prevent him from having the actual major stroke that we talked about, which is the ischemic stroke. So this is actually very, very important, and I will just briefly mention that. Now, next slide. So very, very briefly and basically, we have, this is a diagrammatic depiction of the blood vessels. Since we are talking about the brain, we are talking about blood vessels, we have to actually know what we are talking about, the organ involved. And here, as we know, that there are four arteries essentially that come out, arise from the heart, two from the front of the neck, two at the back of the neck, and they go and supply the brain. And in the brain, they follow all the nooks, crannies, crevices, and essentially supply blood to all parts of the brain. And not only on the surface, they then dive deep into the surface of the brain and also supply the rest of the brain. So if one understands that where the blood is coming from, which parts of the brain it is being supplied, then one can very easily understand the effects of the blood supply being cut off to that particular part of the brain. Next slide. So as I mentioned that there are two types of stroke, that is the ischemic stroke, wherein there is a blockage in any of the blood vessels. Either that blockage is originating from elsewhere in the body, most commonly from the heart, that or from the artery in the neck, the carotid artery. If there is a small blockage or what is called a thrombus, which travels to any of this part of the brain, then that part of the brain will be devoid of any blood supply. It will have a stroke, or it can originate from a blockage within the brain itself. So this is the commonest, as I said, 87%. Most of what we talk about and discuss and treat in the hospital is this type of stroke. Whereas the hemorrhagic stroke is the one where there is actually a rupture from a weakness of the blood vessel wall, and there can be blood spilt within the brain. So these are the two main types of stroke that we deal with. Next slide, please. So as I mentioned before, that the effect of the stroke, the symptoms will depend on which part of the brain it is being affected, which artery which is going to which part of the brain will then define what are the symptoms. So as we know that the brain has lobes, the frontal lobe, the hindbrain area, the back of the brain, this is related to vision, this is affected memory, speech, this is affected the temporal lobe is about speech and language and even memory. So the entire presentation, as we call it, of symptoms will depend on which part of the brain the stroke is affecting. Next slide, please. Apart from individual lobes, which are same on both sides, as we also know that the left brain and the right brain, they also have different sets of functions. So a person, for example, a right-handed person, I'm sorry, his speech resides in the left hemisphere. So if he has a stroke affecting that relevant part of the left hemisphere, he may not be able to speak. Whereas a similar stroke, which happens on the right side, it may not affect his speech at all. It may affect some other functions. So it all depends on which artery affects which lobe and which part of the brain. That is where the symptoms come. Next. So why are we discussing this? As I mentioned, that stroke is a very, very major problem, especially now in the lower and middle income countries. It is one of the leading causes of death and severe disability. This is more important, death and severe disability. Anyone who is familiar with any family or friend having had a stroke, you know how much impact it has on that person, on that family, the social, economic impact is huge. So, especially in the lower and middle income countries, stroke is a very, very major health problem. And in India, the incidence of stroke in India is about 150 persons per 1 lakh persons per year. 150 new strokes per lakh persons per year. You can do the math yourself in a country as populous as ours. Next slide, please. So as I said, we have a lot of Western data which tell us the incidence, etc. But I was very, very proud to dig out these kind of documents which have been published. This is a more than 100-page document which essentially deals with guidelines for management, prevention, and control of the very, very important non-communicable diseases like cancer, diabetes, cardiovascular disease, and stroke. These are all there. These are published and they say exactly what I'm trying to stress upon here, that stroke is a very, very important problem in the community. It leads to a lot of death and disability, but most importantly, the disease by and large, and I will just quote verbatim from here, the disease by and large can be prevented by making simple changes in the way people live their lives or simply by changing our lifestyle. This is really the important message that we want to get out here. Next slide, please. I'm sorry. Next slide again. And this also shows that compared to say 1990 to when this study was done in 2016, our longevity has increased. Male and female, the longevity has increased by almost about 10 years. But if you just focus on the blue parts of this pie chart, the blue parts, this signifies the death and disability from the non-communicable diseases. This has increased, say from 1990, where this much, and this is 62%. So the pattern of illness in our community, now that we are leading longer lives, we have more access to healthcare, technology, diagnosis, and treatment of various conditions. We are probably living longer. Not probably, we are living longer. But are we necessarily leading healthier lives? And that longer life that are we leading, are we spending a lot of that going in and out of hospitals and getting treated of the consequences of these non-communicable disease, that is diabetes, cancer, stroke, heart disease? Next slide. My sincere apologies. I'm actually just recovering from my second round of COVID, and I had to take this week off, and hopefully I'll be back to work next week. So, as I mentioned, symptoms, it all depends on where in the brain the stroke affects, but some very well known and catchy acronyms like FAST or Be Fast. That means if a suddenly, if a person develops balance problems, he loses vision in both eyes, but most commonly in one eye, or either loses it or it becomes blurred for a period of time. If there is facial drooping, that means you ask a person to smile, but one part of the face, or one side of the face is drooping. Or arms, if you ask the patient to, or the person to lift both arms, he cannot lift one arm completely. Or if there is a problem with the speech, it suddenly becomes slurred, unintelligible. You cannot actually understands, and what for the casual onlooker it may seem as if this person is confused, but he's not necessarily confused. His speech is being affected because of an ongoing stroke. And when you have something like this, then time is of the essence. Next slide. And why is time so important? Time is brain. And that is the crux of the whole thing. Each minute in an ischemic stroke, the one that we are the commonest form of stroke, each minute, 1.9 million brain cells die. The figures are absolutely mind boggling. 1.9 million brain cells, or 13.8 billion synapses. Synapses are the connections that happen between the nerves in our brain. So 13.8 billion, or 12 kilometers of nerve fibers which are lost in a minute of stroke. So I cannot emphasize enough that time is brain. So from the point the person starts having a stroke to recognition to bringing him to a specialized center, every minute counts. And every hour delay, the brain loses as many neurons as equivalent to 3.5 years of normal aging. Can you believe that? This is absolutely astounding, that how much damage, ongoing damage, happens when the person, from the time the person starts having a stroke. Next slide, please. So, say a person has started having these symptoms, then you recognize someone in the household, family, friend, whatever is having these symptoms, and you recognize, now that you know the acronym, you know the symptoms, and be fast. So the person is immediately rushed to a hospital setting. And what happens here is what I want to briefly talk about. Now, here, person comes into the emergency room, and with the symptoms suggestive of stroke, most important the thing that the doctor on call or duty will say is the history. As I tried to emphasize before, it is the history, the symptom of onset, which will actually determine whether this person is having a stroke. So when it started, which side was it, did it have headache along with it, is the person conscious or semi-conscious? All these are very important. We will quickly go through whether a person has had comorbidities like hypertension, that is high blood pressure, has had a history of a heart attack, diabetes, or even previous TIAs, as I mentioned. And of course, we will go through all the medication that the person is in, commonly aspirin, certain blood thinners, or cardiac medications. So within the first few minutes of arrival, we can have a very, very good idea in the hospital emergency setting whether this person is having a stroke. Once that diagnosis, at least a clinical diagnosis, is established, we immediately proceed to do certain tests, remembering that time is of the consequence. Time is of the essence here. So immediately a CT scan of the brain is performed. This is the fastest, quickest way of knowing whether or not a person is having a stroke. And if so, what kind of stroke? Because as I mentioned before, both these types of strokes, they have a completely different treatment arm. The treatment algorithm for both these strokes is completely different. So we need to make that distinction very, very earlier on. That is this person having the standard common garden, the majority type of stroke, which is the ischemic stroke, or is he actually having bleeding inside the brain? And you do a quick CT scan, and that will exactly tell you what the diagnosis is. In certain times when the diagnosis is not absolutely apparent or evident on the plain CT scan, then we go for an MRI. But MRI is not absolutely essential because MRI is a more time consuming procedure. And if we can establish a diagnosis on the CT scan, we go straight to the treatment. Whilst all this happening, concurrently, certain blood tests are taken, blood is drawn from the patient, certain important things like the lipid profile, as we know, the cholesterol, we want to know the coagulation factors, and other special tests are done. And concurrently, very, very importantly, at least a basic heart evaluation with an ECG and an echocardiogram are done, and certainly to rule out certain things like atrial fibrillation. I may mention a bit more about that later. Next slide. Next slide, please. So, as I said to you, that not everything which looks and sounds of what I've said is a stroke is necessarily a stroke. Excuse me. So, not everything is a stroke. And this distinction is not for a person or a layperson or someone in the household to make. This distinction is made after the person comes into the emergency room. When a doctor sees, when a doctor goes through all the steps that I mentioned before of taking the history, doing some imaging, some basic tests, and doing a CT scan, only then we can reliably exclude some of these common stroke mimics. For example, fits, epilepsy. This is known to everyone that person comes in with sudden jerky movements, and sometimes what happens after a fit is one part of the body can seem paralyzed for a period of time up to 24 hours. So that person has just had a fit. It's not had a stroke. Again, some types of migraine, we all know migraine as predominantly a headache disorder, very severe headache, sometimes blurred vision. But some types of migraine can also cause weakness of one part of the body. And that is not a stroke. It is in that person, it is a manifestation of migraine. Certain conditions which cause sudden rise in blood pressure. So patients who have suffered from, say, chronic kidney disease, who may be on dialysis, they are prone to having certain situations where the blood pressure rises very high. And that can give rise to symptoms and signs of a stroke. It is important to exclude that. Multiple sclerosis, I won't talk about much. But again, head injury, especially in the elderly, this is something we see so very, very common. Now, we know that stroke is common in the elderly, but stroke is not the only thing which affects neurological functions in the elderly. And a chronic blood clot in the brain, what we call a chronic subdural hematoma, can also mimic a stroke. And we see this very, very frequently in a specialized center, tertiary referral hospital setting. Elderly people who come and who say have been nominally diagnosed to have a stroke, and in fact, sometimes blood thinners have already been started. But when we see the patient, when we do the CT scan, we do the MRI scan, we find that it is a chronic hematoma and not a stroke. So this distinction is very, very important to make. We all know about certain drop attacks like vasovagal, say being hungry for a long time, standing in the sun for a long time, having a drop attack, but that's not necessarily a stroke. But it is important to recognize that it is this and not a stroke. Okay, next slide, please. So again, very briefly, I don't want to go into a lot of technicalities, but since we mentioned that the vast majority of strokes are this variety, what we call the ischemic stroke, where there is stoppage of blood to part of the brain, then the treatment is to resume the blood circulation to part of the brain. And since it is due to a clot in a blood vessel, the simplest thing is to dissolve the clot. And we have two means of doing that. One is if the person comes into the emergency room, has all the tests and the diagnosis in the shortest possible time, 3 hours, under 3 hours, maybe up to about 4.5 hours, a certain medication called IV TPA can be given just by the intravenous route. Just by giving this drug by the intravenous route in an appropriately timed and diagnosed fashion can save a lot of the brain which is at risk from having a major stroke. So the number one treatment of what is the ischemic stroke is a simple IV medication. Next, next slide. And in more specialized centers and in certain other conditions where the IV drug has been given, there is the option of also doing a mechanical clot removal. That means the clot has actually blocked the artery, the blood thinning medication, the clot busting medication has already been given by the intravenous route. There is an option of putting a catheter and then a basket into the blood vessel and retrieving the clot. So this is now what would be considered to be the state of the art treatment for an acute ischemic stroke in the brain, with which to a person that comes in a well-defined time interval into the hospital. So this is a mechanical treatment of ischemic stroke. Next. Very briefly, I will talk about it. But since it does form, certainly in the hospital setting, a hemorrhagic stroke does form a fairly large percentage of patients, and especially to a neurosurgeon. I just want to make that distinction that the first group, which is the ischemic stroke, which as said is the large proportion of strokes, is dealt with medically by the neurology team, the medical team. The hemorrhagic stroke, where there is actually blood spilt within the substance of the brain, is largely dealt with by the neurosurgical team. And so the most common varieties are those due to hypertension, okay, what we call a hypertensive bleed. So the vast majority of these hemorrhagic are the hypertensive bleeds. Again, a vast majority of them are treated medically by measures to reduce the size of the clot and pressure on the brain. And some of them go on to have surgical removal. That means taking out the blood clot from the brain. And there are, of course, other more complicated diagnoses and their treatment. I don't want to go into details, but this is basically it about hemorrhagic stroke. Next. Sorry. So really, having spoken, given you a flavor of the spectrum of strokes, the kinds of strokes, the kind of problems it causes, why are we here today? All that I said is probably bordering on technical, clinical, and the actual disease itself. But what can you and I, as persons ourselves in the family, in the community, what can we do about it? Well, the good news is that the vast majority, more than 80% of strokes, all that I've spoken about, is preventable. Remember this again, the vast majority, 80% of strokes are preventable. And how are they preventable? Because we know that there are certain very identifiable and modifiable risk factors. Identifiable and modifiable risk factors. Why am I making this distinction? So, for example, if you have a family history that is genetic, age, elderly people, sex, female, and there is a slightly higher predilection for strokes amongst women compared to men, and ethnicity. So, these things cannot be modified. So, these are not modifiable. In the US, blacks have more strokes than whites. It is known, it is proven. That is not modifiable. But all these here, these conditions like high blood pressure, heart disease, diabetes, high cholesterol, and then dietary, physical inactivity, obesity, alcohol, tobacco, stress, all these are modifiable risk factors. By making simple lifestyle changes, one can dramatically reduce or completely curtail the incidence of stroke. So that is the important thing here. Next. Just to mention one of the risk factors, high blood pressure. High blood pressure is so common in the community that 1 in 3, and these are American stats, say 1 in 3 American adults with high blood pressure don't even know they have it. Why? Because high blood pressure in itself does not actually make any symptoms till it gets to the point that it causes damage to certain organs like the brain, like the eyes, like the heart, like the kidney. Therein come the symptoms. But high blood pressure themselves does not cause any symptoms. For a third of people who have high blood pressure don't actually know they have high blood pressure. But then people with high blood pressure have a significantly higher risk of stroke. Okay. And at the age of 50, without high blood pressure, people have a life expectancy 5 years longer. 5 years longer if you don't have high blood pressure at 50. So, blood pressure, hypertension, so commonly talked about, and perhaps the guidelines, the actual levels of high blood pressure are also ignored or not paid adequate attention. So, a normal blood pressure would be considered. We know that blood pressure has two numbers, right? One at the top, one at the bottom. The top is the systolic blood pressure, and lower is the diastolic blood pressure. The systolic blood pressure should be less than 120, and the diastolic should be less than 80. Again, the systolic should be less than 120 and the diastolic less than 80. Anything beyond that, so for example, if you look at the next line, anything beyond that, say, no, previous slide again. So anything beyond that, so if a person has a systolic of between 120 and 129, that would be considered to be elevated blood pressure. So, so the diagnosis and adequate treatment of high blood pressure, which is one of the commonest risk factors of stroke, is very, very important. And by doing these simple things, identifying high blood pressure, treating it with appropriate medication in a timely manner, can prevent a very, very large proportion of strokes. Next slide. Similarly, smoking. Smoking is very, very common, especially in the lower socioeconomic group. Smoking is common. Okay, but smoking contributes a very, very large percentage of the sole risk factor for stroke. So, up to a quarter of all strokes are directly attributable to smoking, up to 25% smoke. So, a simple lifestyle change like stopping smoking or alcohol or, sorry, tobacco intake in any form can dramatically reduce the incidence of stroke. Next slide, please. So as I mentioned again that we have talked about risk factors. So all those things that we can do for ourselves to modify, curtail, reduce, and completely nullify those risk factors, that is by eating a healthy diet. And here, a healthy diet, which is now recognized to be most healthy, is actually a whole food plant-based diet. A whole food plant-based diet is considered now by statistics, by studies, to be shown to be the most heart healthy diet. So a diet rich in plenty of whole foods, plants, fruits, vegetables is considered to be the most heart healthy diet. Then reducing processed foods, reducing sugar, reducing salt, for example. Do we know that the maximal allowed limit for salt, daily salt intake is only 6 grams per day? Only 1 teaspoonful of salt per day is actually said to be the safe limit of salt. Then talking about exercise, the recommended physical activity should be at least 30 minutes of moderate to vigorous physical activity 5 days a week. So 2.5 hours of moderate to vigorous physical activity 5 days a week. That is your minimum diet of exercise. So if we can modify these known risk factors, if we can make certain lifestyle changes, avoiding alcohol, stopping smoking, taking care of our blood pressure, taking care of our diabetes, taking our medication in time, take good amount of sleep, a proper attention to diet, these things can dramatically, and I think I have shown you perhaps repetitively so that most amount of strokes, they are preventable and they're preventable by these lifestyle changes. Next and next again. So finally, I just want to leave you, next slide. I just want to leave you with these take home messages that stroke is amongst the leading cause of death and disability. I think I will focus on this disability. To have a person, a relatively young person at home who's disabled from a stroke, I think there is nothing more destroying than that. And I think myself, Dr. Roy, me, us being in this specialty, we see firsthand the kind of anguish that a family has to go through to have a person, perhaps sometimes the only earning member of the family, being severely disabled from a stroke. There is nothing more destroying than that. So if we can do something to prevent that, and it is in our hands, I hope I have been able to show you, it is actually in our hands. This is not theoretical. This is all proven. All the measures, all the statistics, all the graphs, every bit of detail I have shown you is proven. It is in our hands to prevent one of the most devastating conditions that affects all of mankind. So stroke has tremendous social and economic impact for the individual, for the family, and society at large. And early recognition, as I told you, time is brain, and prompt treatment in specialized centers can limit the damage and promote a very good prompt functional recovery. And now we have specialty stroke rehabilitation units also. It is not just the medical care, it is not just the in-hospital care, it is what happens after the person leaves the hospital that is as, if not more important in the long run. So proper physical therapy, occupational therapy, rehabilitation, this can actually speed up the recovery from the stroke process. And again, to emphasize that the vast majority of strokes are actually preventable by making simple, healthy lifestyle choices and changes. Thank you very much.
Thank you, Harsh. You all will agree that he has done a great job of explaining the stroke, what causes it. Harsh, with your permission, I summed up your presentation in a couple of slides. If I can just read it out for everybody. Abhishek, can I have the first slide, second slide, please? So we are going to tell you what Harsh has said just now. Harsh being a great neurosurgeon and with a huge experience of managing stroke in the hospital. As he said, the time is the brain. If you have the time, you will save. If you come in time, you will save your brain. He says that brain attack is the third most common cause of death, most common cause of severe disability. It's a medical emergency and treatment must be sought as quickly as possible. Within 3 hours, if you bring the patient, next slide, you will probably save the brain. And next slide. What are the alarming signs of brain? Which mention sudden numbness in the face or loose feeling in the hands. We are just recapitulating whatever he has said. So you identify the signs early. You will have it, not necessarily only elderly will be affected. Anybody can be affected. Sudden numbness on the face or loose feeling in the hand, feet, they like tingling, constantly touching, massaging or shaking the numb area. Because the area is numb, so they keep on touching it. These are the signs which you can observe in old people. They may not say anything, but if they keep on rubbing their hand, you ask them, why are you rubbing your hand? They will tell you that it's numb. Sudden severe headache in the head, neck or the back without any cause. They just headache came. They are touching their head or rubbing their temples and sensitive to the light. They are very light sensitive. They say, switch off the lights. I don't like the lights. These are the early signs. Next. Confusion and difficulty in understanding. You can see a puzzled look on their face. They have a bit difficult in focusing. These are all signs of stroke. More difficult time comprehending speech, language, or number. When you tell them what, when you're talking to them, they're not able to understand you. The same person who could understand you till yesterday is not able to understand you today at this point when you're talking to him. They might wrinkle their eyebrows. They might shake their head. They talk less or feeling very unsteady. Next. Loss of balance and loss of coordination. You ask them to touch their nose with their finger. They will not be. It will go here, it will go here. May walk around with difficulty. They may have difficulty in standing. These are the early signs of stroke. Next slide. They may have a dizziness and they may notice things too. These are all early signs of stroke again. Next slide. They have trouble speaking and they have severe weakness. So these are the 10 signs of symptoms which Harsh has elaborated. We just compiled it for you to understand, recognize stroke at home and seek treatment. Bring them to the hospital. As he has said, that time is brain. The earlier you come to the hospital, sooner he can be treated. He doesn't have to be paralyzed. And as also Dr. Harsh said, that we need to diagnose it quickly, we need to treat him. There are 3 types of stroke, he said. One, because of lack of blood supply, where there is no blood supply to the brain, which happens because of the blockage of the artery. Second is said bleeding in the heart, brain. Third is said TIA, transient ischemic attack. These are early signs that patient may be having impending attack, where the stroke-like symptom disappears in 5 minutes to 24 hours. Dr. Harsh also mentioned that we may treat them, but we don't want you to be treated. We want you to prevent it. How to prevent it? He has given us some very simple ideas. Cut down on your weight, exercise regularly, control your blood pressure. Control your blood pressure. He specifically mentioned don't keep it above 120 systolic side. Control your blood pressure, my friend. That's one of the biggest leading cause of stroke. Diabetes, exercise, stop smoking. Smoking is your last time, Winter and Lung, we said, cigarette destroys your lungs. Now we're telling you it destroys your brain too. Why are you smoking? I don't understand. But then stop it, it'll help you. A change in the lifestyle. And as he said, very important, which I loved it, that whole plant-based food is the healthiest food for you. Eat plant-based food, whole food, not a processed food. Don't take sugar. If you take sugar, take good. Don't take salt. Avoid salt, avoid sugar, and probably you'll be healthier and less prone to stroke. Some of the reasons why we are here, we want you to stay healthy. We want you to stay fit. And we want you to live a happy life. I'm extremely thankful to Rotary Club of Avanya for participating, joining with us, and Bengal Chamber of Commerce. I've got 2 questions which people have asked. I want to bring it to Dr. Harsh. And before that, please write down my number, 74396 00616 is my WhatsApp number, 74396 00616. Send as many queries and we will answer it. We want you to stay healthy. Dr. Harsh, there are 2 questions which were asked. One, that what is the role of aspirin? Though you mentioned that aspirin helps in prevention, that should people take aspirin as a preventive measure, and what age and what dose?
Okay, so very important. So there are 2 things. One is primary prevention and one is secondary prevention. So the role of primary prevention is when a person has not had a stroke. Okay, whether or not aspirin should be given in that situation. And secondary prevention is whether if a person has had a previous TIA or a stroke, and to prevent another event from happening. I think currently the data are that uh, for primary prevention, probably aspirin is not a very good idea. It is not proposed nowadays. Despite it is more important to modify the risk factors rather than take aspirin for primary prevention, simply because aspirin itself has many complications. So there is a risk of bleeding into the brain, etc. So nowadays, for primary prevention, that means if you have not had a stroke before, then it is more important to take all the medications for your diabetes, hypertension, cholesterol, rather than take aspirin also. But if you have had a stroke or a heart event or a heart attack, in that case, aspirin or having any of these other blood thinners is very vital for you. And the dose of aspirin is usually 75 milligrams.
There's a question from somebody, a gentleman who had a stroke and was treated. He says he has mind tingling on his fingers and numbness in the toes. So how long will it last and how much time will it take for it to disappear completely?
Right. So, hello, Mr. Bose. So, I note that you had a stroke in February of 21. So that's 1 year from the event now, exactly 1 year. Now, a lot actually depends on how severe was the stroke, how established the stroke was by the time any treatment was done. So, despite all our efforts, it is a fact that certain parts of the brain are irreversibly affected because of the stroke. Irreversibly affected. One cannot, wish away that fact. A stroke has happened, which is why one has had those symptoms. The idea of when you reach the hospital and institute quick treatment is to prevent it from getting worse, to prevent a larger area of the brain from being affected. But if that part of the brain has been irreversibly affected, then I'm afraid you may not get 100% of your feeling numbness that you have already. But I would still say 1 year is early days. Normally, we say up to about 2 years, one can still expect some amount of neuronal recovery.
Dr. Harsh, there was a question that what kind of food you would advise for those who are above 60 to prevent stroke?
Right. Now, this is a very, very important topic, very close to my heart. And I also know from personal experience, Dr. Roy's heart. Now, I really, on a platform like this, I do not want to get into a vegetarian versus non-vegetarian debate, protein versus different type of protein debate. We do not want to get into that. But I can share with you on a personal level, and you're very free to locate on the net certain very, very important and good sites, which will tell you that the balance of opinion now worldwide is that exactly what I said, a whole food plant based diet, which means it consists of whole foods, grains, especially lentils, millets, etc., plants or plant based, so all our vegetables, fresh fruit and vegetables. This is actually the most heart healthy diet. But to actually say that what are the things you should avoid, probably that is easier for me to say. So salt in the diet is very, very, very damaging beyond a point. Sugars, any form of these, and especially processed foods, which have very high salt and sugar content. So processed foods, sugars, and salt. And again, vegetarian, non-vegetarian, that is a personal preference. But bottom line is these plant-based diets are actually what is heart and brain. And the key fundamental thing of what I want to tell you that everything that we talked about applies to the heart and brain, because both these are the main. We are talking about cardiovascular health. Okay, cardiovascular health. So anything which is healthy for the heart is also healthy for the brain, because the brain is being supplied by blood. The blood is coming from the heart. It is the blood vessels which need to be healthy. So we are talking about cardiovascular health. So anything across the board. So smoking, hypertension, diabetes, diet, exercise, all these things, if you can do them in the actual amounts which have been prescribed, it is not just good enough to go for a stroll. It is not good enough. It has to be moderate to vigorous exercise, 30 minutes of moderate to vigorous exercise for 5 days a week. That is the prescription. Anything below that is not applicable, does not reduce your risk. Anything more than that is healthier, but below that is not applicable. So similarly, diabetes, hypertension, everything. I'm very, very passionate about this subject, and I would say, and again a bit philosophically, I would say that the pandemic has almost put a full stop to life as we knew it. It has given us time to introspect on many, many aspects of our health, not only just physical health, mental health, emotional health, financial health. We have actually had the time, probably the first time in generations, to look into all these. And I know, and I'm talking from personal experience, in fact, as I mentioned, this is my second round of COVID. I had COVID prior to the vaccination came. That time I was off sick, I was at home, fortunately, and then again, a lot of support from Dr. Roy personally and Medica. I made it out of there without any problems. But that time, that year of introspection really made me feel, what can I do about my own health? And I did it. And again, I would tell you, I was grossly overweight. I have no compunction in saying I was weighing at about 92 kgs one time. Within 6 months to 8 months, I brought myself down to about 77, 78 kgs by a combination of dietary restriction, rather modification, and exercise. And I felt much, much better, much, much healthier. So these are things that you can do, which is not good enough to say, okay, medicines, okay, this, okay, that. It's not good enough. These are things, and these are not easy things. All the things that are spoken about, they take a lot of time, they take a lot of effort, sustained effort. Don't go for very big goals. Don't go for big weight loss goals. You will never achieve them. Go for small goals, but be consistent and throughout. That is the important message.
Thank you, Harsh. Just to let you know that Harsh is suffering from COVID and he's operating from home. He was very unwell, but I said we need to talk to people, and he most generously agreed to come online. As you can see, he still can't talk very well. He has a mild cough and all that, but he's managing. And thank you, Harsh, for that. And he really brought few things very clearly. He said that do exercise properly. Otherwise, we find a lot of stroller assembling on sharmas and other dhabas for early morning club kachori after the stroll. Stop it. Take care of your health. A healthier you is a better you. And knowledge is not in hearing, knowledge is in living. Whatever we are telling you, make wisdom lies in accepting it and implementing it in your life. There's a purpose to for you to stay healthy. And somebody, last question, somebody asked that is a health checkup. Health checkup is always good. Get a checkup done. That prevents heart attack and brain attack both. With this, we come to the end of our session today. I again thank Harsh and all the participants. My thanks are due to two organizations, Rotary Club of Avanya for joining hands with us and Bengal Chamber of Commerce and Industries. Stay connected every week, every Saturday, 5:30 to 6:30. We are here with you to keep you healthy. Medica wants you to stay healthy, so you don't have to come to us. And we will bring all the information to you for you to stay fit and fight and live life. Don't suffer in life. Thank you very much. Have a nice weekend. Thank you, Harsh.
Thank you very much. Thank you.
Thank you.
Thank you.